My Story, My Journey, Your Awareness, which is aimed at promoting early cancer diagnosis for the population of Wirral and also across Cheshire and Merseyside. This is one of the community partnership programs between Cheshire and Merseyside Cancer Alliance and local CVS across the region.
My name is Michael Crowe. I'm aged a young 64 now. Okay, I live in Liverpool, and yes, I'm a prostate cancer patient, or survivor, I should say. Yeah, I have my children. Most of them are based in Liverpool, and yeah, I'm a happy father and grandfather.
My name is Nambi Rajan. I'm a consultant urologist specializing in urological cancer, particularly prostate cancer. I've been a consultant in the NHS for the last 20 years. I work in Wirral University Hospital, popularly known as Arrow Park Hospital. Yeah, if you're a man living in United Kingdom, you have got the background risk of 1 in 8, which means 1 out of 8 men will have prostate cancer in their lifetime. And if you are a man belonging to Afro-Caribbean ethnicity, like a black man, your risk doubles, which means the risk becomes 1 in 4. So 1 out of 4 men will develop prostate cancer in their lifetime. So if you have family member who has developed a prostate cancer, they had a prostate cancer, like your father, uncle, brothers, or a female member of the family, like mom, and if they have breast cancer, sisters developing breast cancers, then you are at a much higher risk than an average person. So you need to think about, if you are in the high risk group, start thinking about your risk and go to your GP and then discuss with them about what the possible tests they can offer to you. So if you have a PSA blood test and it comes back as raised, and the doctor has excluded other reasons for the raised PSA, you will be referred to your local urology department. The urology team will assess an MRI scan, magnetic resonance imaging. It's just like you're having a CT scan, but a little bit more sort of close to your body. And it's a very easy test. It's a non-invasive test. There is no pain associated with that. And that scan gives us more information about what is going inside your prostate. And depending on what changes we find inside the prostate, the urologist will advise you to have a biopsy. A biopsy is a test where you put in a needle into the prostate and take a piece of tissue to find out what's going on. This biopsy is usually done under local anesthetic, meaning you are not put to sleep, you will be awake. They will give you something to numb your skin and the prostate and put a needle in the area we see the change in the MRI scan. So we can specifically do what we call as a targeted biopsy, and we will know exactly what's going on.
I was fortunate to have a sister in the nursing profession, which is a senior nurse, and she mentioned, because I was coming to a certain age of 47, 48, to have your prostate check, especially being a black man, growing up and being active in my lifetime, and I decided to have a check through my sister. First results came back where I was on the borderline. I didn't have any sort of background from my family with any sort of cancer issues. Well, at the time, the treatment was offered because it was an early stage to what the clinicians said to me, is to put your mind at rest. And certain questions was asked, do you plan to have more children, or, these are the things what are important to you, or what's important to you, in life. There is certain things what was offered where I can have chemotherapy, radiotherapy, because it was the Gleasons I had, which is like the polyps, which can turn cancerous. Or I could have left it because what they're saying, it was left dormant. They could have been there for a while, for years and years. But, you know what I mean, so, and I thought, well, what's going to make them active where it'll start making active where, you know, so, yeah, everything was by choice, my choice, and I decided to go for the robotic surgery, even though the other, what I was offered basically was good, each one, but I think for the early detection that made up my mind because of that, and also the recovery time as well for the robotic surgery, which was quite new at the time. Okay, and the recovery time was brilliant. Well, my message to you is, first of all, if you are from a black origin, African black origin, is to have your PSA checked. Early detection is first early diagnosis or early treatment. Okay. Now, you have 1 in 8 men, white men, will discover they'll have prostate cancer, but more so 1 in 4 black men will discover they have it, you know, prostate cancer as well, or discover there's some form of cancer. So it's very, very important that if you are of age or if you are of Afro-Caribbean origin, okay, that you go and get your PSA checked by your GP.
Start thinking about risk of prostate cancer if you turn 50. If there is any history of prostate cancer in family, or breast cancers in the female member in the family, or if you are a black man, your risk is higher. So go to your GP, discuss the pros and cons of having a PSA blood test so you can make an informed decision. If you have any urinary symptoms, please don't ignore them. Go and discuss with your GP and they will be able to advise the necessary tests that you need to undergo. Early detection of prostate cancer saves lives. So the earlier you approach your GP, it is better for us, and we will be able to offer lots of different treatment options, and thereby we can reduce the side effects.